Have you ever walked into a room and forgot why you were there? Or picked up the phone but couldn't remember who you were about to call? You might laugh and say, "Oh well, I'm just getting older." But sometimes it's not aging, it's the medication. Every day, millions of older adults in America feel foggy, distracted, forgetful. And most think it's just part of getting old. The truth is, many common drugs, like allergy pills, painkillers, sleep aids, even anti-anxiety meds, can slow down your brain. And worst of all, these are pills we take every day, prescribed or over the counter, without knowing the risks. In this video, you'll learn why seniors react more strongly to meds, 7 types of drugs that may cause brain fog, how to tell if it's the pills, not a disease, and how to talk with your doctor to stay sharp while staying safe. If you want to stay independent and mentally sharp, or you have loved ones over 60, subscribe. Every week, we bring you simple, science-based tips to help you take charge of your health and Why are seniors more vulnerable to medication-related confusion? Here's something most people don't realize. The brain doesn't age randomly, it changes in very specific scientific ways. As we grow older, the brain gradually clashes slightly in size, implicated in processing information, produces less of key chemicals like acetylcholine, which is vital for memory. Because of these natural changes, the aging brain becomes more sensitive to the side effects of medication. The same drug can affect younger and older people very differently. Take the same pill, a young person might feel alert, but an older adult might feel drowsy, sluggish, or mentally foggy. Why? Liver and kidneys process drugs more slowly. Brain is more easily overwhelmed by substances that seem harmless in younger adults. And don't forget, many seniors take 5 to 10 medications a day. These drugs can interact, increasing the risk of confusion, dizziness, or even falls. The real issue isn't whether a drug is good or bad. The key is understanding this. The same medication can have very different effects on a 30-year-old and a 70-year-old. So if you've ever tell me sluggish after starting a new medication, it might not be just aging. It could be your brain's gentle way of saying, hey, something's not right. 7 common medications that may cause memory loss, and you might be taking them without knowing it. Imagine this. You eat healthy, go for walks every morning, and live a clean lifestyle. But your memory starts slipping. You tell yourself, it's just aging. But sometimes, the real culprit is sitting in your medicine cabinet. Here are 7 types of medications that the FDA and leading geriatric experts in the US warn can impair memory, focus, and alertness, especially in adults over 60. 1. First-generation antihistamines, diphenhydramine, chlorpheniramine. You might know them by brand names like Benadryl, Tylenol PM, or nighttime cold medicines. The problem: these drugs cross the blood-brain barrier and block acetylcholine, a brain chemical critical for memory and alertness. You may notice deep drowsiness, slower reaction time, forgetting where familiar items are. What doctors in the US recommend: switch to second-generation antihistamines like loratadine, Claritin, which have fewer effects on the brain. 2. Benzodiazepines, diazepam, lorazepam, alprazolam. If you've ever taken Valium, Ativan, or Xanax for anxiety or sleep, listen up. The problem: these drugs slow down the central nervous system. In seniors, this can lead to confusion, falls, and long-term memory decline. You may notice repeating questions, losing track of time, difficulty finding words. US guidelines suggest ask your doctor about non-drug options like CBTI, cognitive behavioral therapy for insomnia, or melatonin as a safer sleep aid. 3. Tricyclic antidepressants, TCA, amitriptyline, doxepine. Some older doctors still prescribe these for sleep, chronic pain, or anxiety. The problem? TCAs have strong anticholinergic effects, leading to brain fog, dry mouth, constipation, and serious memory issues. You may notice forgetting what you were about to say, walking into a room and forgetting why, daytime drowsiness. In the US, newer antidepressants like sertraline, Zoloft, or citalopram, Celexa, are preferred for seniors. 4. Opioid pain relievers, hydrocodone, oxycodone, morphine. Common after surgery or for chronic back, joint, or nerve pain. The problem? Opioids slow brain activity, increase confusion risk, and may cause dependence or depression over time. You may notice disorganized speech, dozing off during the day, trouble with balance. US guidance: use opioids only short-term, at the lowest effective dose, and try alternative pain relief methods first. 5. Overactive bladder medications, oxybutynin, tolterodine, used to treat frequent urination or nighttime accidents. The problem? These drugs also have strong anticholinergic effects, especially risky for women over 65. You may notice confusion at night, rambling speech, forgetting whether you've taken your meds. Safer option in the US. Ask your doctor about mirabegron, Myrbetriq, a newer, brain-friendly alternative. Certain blood pressure medications, propranolol, clonidine. While managing blood pressure is essential, not all medications are senior-friendly. The problem: some can cause fatigue, mild depression, and cognitive slowing, especially in high doses or when mixed with other drugs. You may notice slower reaction when driving, mild confusion, trouble concentrating on reading or TV. Tip: ask your doctor, is my blood pressure medication affecting my thinking? A medication review may be needed. 7. Anti-seizure medications, gabapentin, pregabalin. Now widely prescribed for nerve pain, sleep issues, and even anxiety. The problem? Older adults may be more sensitive, leading to brain fog, short-term memory issues, and reduced mental flexibility. You may notice disorientation, difficulty learning new things, struggling to follow fast conversations. In the US, neurologists start with the lowest effective dose and monitor for side effects after 1-2 weeks. So what should you do next? How can you tell if your memory issues are caused by your medications? What warning signs should you watch for? And how do you talk to your doctor without being dismissed? All of that, in the next part of this video. Is your memory being affected by medication? In today's world, it's not uncommon for older adults in the US to take 5 to 10 medications a day. But sometimes, that combination can leave you wondering, is this just aging, or is it the medicine? Here are some surprisingly common signs that your memory might be affected by the medications you're taking, and many people overlook them. Red flags to watch for. You repeat the same question, even though it was just answered minutes ago. I say the name of a grandchild who lives with you. You struggle to express simple thoughts. You feel lost in a parking lot and can't find your car. You feel like your brain is in a constant fog. These symptoms aren't always caused by medication, but if they started after beginning a new drug, or they've been getting worse over time, it's time to take action. How to talk to your doctor and be heard. The US healthcare system encourages older patients to speak up. Here are a few sample questions you can ask at your next appointment. Lately, I felt more mentally sluggish. Could any of my medications be causing this? Bring a written list of everything you're taking, including supplements and over-the-counter drugs, along with any symptoms you've noticed. It helps your doctor help you faster. You are not alone. If this video helped you understand the link between medications and memory, then chances are thousands of others need this information too. Subscribe for more clear, practical, and compassionate videos designed to help you stay healthy, sharp, and in control of your own life. 5 golden rules for taking medication without harming your memory. In today's world, medications save lives. But for older adults, taking medicine is like driving on a busy highway. One small mistake, and your memory could suffer long-term damage. That's why geriatric experts in the US recommend these 5 golden rules to keep your brain sharp, even when you're managing multiple medications. 1. Ask the right questions before starting any new medication. Important questions to always keep in your back pocket. Could this medication affect my memory or thinking? Is there a gentler option for someone my age? What side effects should I watch for? Keep a journal of any changes in your mood, memory, or sleep, even small ones. These notes are incredibly helpful at your next appointment. 2. Avoid polypharmacy. The fewer meds, the lower the risk. In the US, taking 5 or more medications per day is extremely common. But each additional drug adds another layer of risk. Seniors taking more than 7 medications daily are twice as likely to experience cognitive decline. Ask your doctor, are there any medications I can stop or safely replace? 3. Don't mix supplements with prescription doesn't-out guidance. Many people in the US take supplements like ginkgo biloba, omega-3s, or so-called brain boosters. But combining them with prescription drugs, especially blood thinners or neurological meds, can backfire. Always bring a complete list of supplements to your doctor, even if you bought them at Walmart, CVS, or Costco. 4. Review your medications regularly with a doctor or pharmacist. Once every 6 months, sit down with a healthcare provider to review everything you're taking. This is often covered by Medicare, and it can be a game changer. I'd like to review my medications. Are there any that should be adjusted based on my age or mental clarity? 5. Listen to your body and speak up. You know your body better than anyone. If you notice mental fog, forgetfulness, or confusion, don't ignore it. Please don't just think, it's probably just old age. Because sometimes, simply switching a medication can bring back mental clarity, often within just a few days. You can't control your age. You can't stop time. But you can choose how you live. You can choose clarity. You can choose to be proactive. You can choose quality of life. Today, you've gained knowledge. And knowledge is power. The power to have better conversations with your doctor, to take charge of what goes into your body, and to protect your memory before it quietly slips away. If this video brought you clarity or hope, share it with someone you love, or hit subscribe to stay with us on this journey to live healthier, think clearer, and live each day with purpose.